Hey YouTube, today I'm going to be talking to you and teaching you how to prime IV set so you can get it all set up and everything. Before I go ahead with it, I just want to say that this is for medical professionals who are learning. This isn't for the general public. So if you're watching and you're not a student or a medical professional, I'm not saying leave, but don't try this. I'm doing this to help other medical professionals learn because that's what I did when I was learning. Anyway, you're going to need uh, administration set. This is a 15 drop set. It's pretty standard. They call it a standard drip set. And you're going to need an IV bag. I'm just using a 500 ml bag because I'm sitting at a computer. So first thing you're going to want to do is open up your bag. And I'm not going to go over all the proper ways to inspect a medication, but you have your bag. Now, for those who are new to IV bags, basically the anatomy of them is pretty simple. There's usually a little port here where you can make infusions, so you can mix medications in here. And then there's this part right here, which is where you spike it. So you have your bag, and I have a little hang right here that we're going to hang it from like that. That looks really funny. And then I have administration set. So, like I said, you look at the drip rate right here. This is 15 drops per minute. So it's a standard drip set, or you can buy a mini drip, which is about 60 drips per minute. So you can open it up like this, and again, when you do this, you're going to want to be sanitary and whatnot, but since I'm teaching it on my computer, I'm kind of ignoring that. So when you open up the drip set, they're all a little different. There you go. But they're all consist of the same parts. So when you open it up, it's going to be a long, long tube, and we're going to start from one end and then go to the other. So the first end right here, you have this spike here. This is sterile, so when you take it out, you don't want to touch it. Then you have this right here. This is your drip chamber. This is how you can measure the flow rate of the IV. Then you have some tubing, and then you have a roller clamp, and this allows you to control the drip rate, whereas this you can see it and measure it. So you have the roll chamber. You go farther down. Usually there'll be some kind of admin port. We have one right here, and then we have the end here. This is the end that goes into the catheter or the saline lock, heparin lock, whatever the practitioner is using. And this is sterile as well, so when you take this off, you don't want to touch it as well. Anyway, so before we can spike our bag, there's a few things we have to do. First is we have to clamp down on our roller here so that water doesn't go everywhere. The second thing we have to do is take the cover off the spike. Once we take it off like this, don't touch it. It's sterile. You don't want to be getting anything into this water. This water is also sterile. So now you see right here, this is the port where we're going to spike. Every bag is different, but for this one, we usually have to, I'm just going to take this off here. We have to pull it like this. It just comes off like that. And this too is sterile. Sterile, if you go a sterile part to a sterile part, you're still sterile. So basically, what you're going to want to do is put this in there and just push. It's best not to turn it like that because you can actually get little bits of plastic into the solution. But you have to try your best until you stick it in like that. Then what you're going to want to do is flip it like that. And what we're going to need to do is we're going to need to fill this drip chamber to about a third to halfway. So we're going to squeeze it. That's a bit too much, but it will still work. Sorry, you can't see that. Just like that. So you can see it's about that high. So hang your bag just like you would. And now we're going to go back to our roller clamp here. Now the next step is called charging the line. And this is basically to make sure that this whole line here is filled with saline so that when you put it on, when you use it on the patient, you're not pumping air into their veins, which can cause a whole whole bunch of problems and do way more harm than good. So what you're going to want to do is, I usually like to take this and put it over the packaging, and I usually just open up the roller ball wide open. And when you open it wide open, you're going to want to watch in your drip chamber here, and you'll see the water running. And in a little bit, we're going to be able to see, actually have to lower down a bit, but you'll want to see water coming out of here. See that water? Once you see water coming out of the tip there, which it is, you're going to close down on the roller ball, and that's pretty much it. So just to reiterate, open up the line wide open, wait till water's coming out of the tip here, look and inspect your line, and if you see any air bubbles, some tiny ones, like I think we have a tiny one right there, that's okay. You just don't want like a big portion like that. So once that's done and it's you've locked it back, you know what you can do is you can take this part, and there's usually a clip on the roller ball, and you can hang it just like that. And now this is ready to use. Person can easily grab it and use it on a patient. When you go into the ER, you see this all the time, these bags hanging here all set to go. So that's basically it. Pretty easy, and I hope that was easy enough to understand. It's kind of hard when you're sitting in front of a webcam. But yeah, so hopefully this helps some future students and gives a bit of a visual. I know that's what I did when I was learning. So yeah, take care.